Hello, welcome back again. I am Samapti Sinha Mahapatra, your zoology teacher teaching in Sri Chaitanya Institute. Students, we have covered some part of the chapter Locomotion and Movement. We have discussed about the muscles part already and we were left with the part which is the bones. Okay, so today we are going to start with the endoskeleton, the bones part, and very important for all of you to focus on the NCERT because past year questions, if you look at the past year questions, they have not asked anything out of the NCERT in NEET, okay? So try to focus on NCERT more and try to focus on the division that I am going to tell you today. So your endoskeleton, in the adults we have got 206 bones, okay? In the during the time of birth, at the time of birth we were having large number of bones, but slowly the bones got fused and we were left with 206 bones ultimately. Now talking about your endoskeleton, you can divide it into the axial skeleton and into the appendicular skeleton. When you talk about the axial skeleton, this is the axial skeleton, and whatever comes out of the axial skeleton forms your appendicular skeleton. Talking about axial skeleton, it is having 80 bones, and the appendicular skeleton, it is having 126 bones. While you talk about axial skeleton, it has got skull, ribs and sternum, vertebrae. Now when you talk about skull beta, it has got several contradictions because in NCERT it is given that skull has 22 bones or 23 bones, okay, but in actual we see that matlab when you say 22 or 23 bones, 22 bones, they have not included ear ossicles, they have not included the hyoid also, okay, when they describe 22 bones in the skull. So according to the question, you will mark the answer. If in option there is 22, you will mark the answer as 22. They will never give you 22, 23, 29 all at the same time, okay. So it can be 22, 23, 29 according to the question, you answer it. Then you have ribs and sternum. Ribs are 12 pairs, so 24 in number. Sternum is 1. You have vertebrae, 26 in number. Talking about your appendicular skeleton, you have got girdle bones and you have got limb bones. So you have got 4 limbs, and in each 4 limbs means total 4 limbs, not 4 limbs. You have got total 4 limbs, 1 pair 4 limbs and 1 pair hind limbs. In total, in each you have got 30 bones. So in total 30 into 4 you have got 120 bones. Talking about the girdle bones, you have got pectoral girdle, you have got pelvic girdle. In pectoral girdle 4 bones, in pelvic girdle you have 2 bones. Now talking about the each part separately, very first we are starting with the axial skeleton, and in the axial skeleton we are going to start with the skull. Now when you talk about skull, the very first bone you have is the cranial bones. Quite easy to remember how many bones are there in the cranium is total 8. Whereas in the facial you have got 14. Okay. 1 point you will remember the name of the bone. Second point you will remember which is paired and which is unpaired. Okay. Third point you will remember if there is any special property related with any of the bone. Now talking about the name of the cranial bones, you have got 1 frontal bone, not 1 pair, 1 frontal bone, you have got 1 pair parietal bone, 1 pair temporal bone, and 1 single you have got occipital bone. That's what I have written: frontal, temporal, parietal, occipital, and what else? You have got sphenoid and you have got ethmoid. Only the temporal and parietal bones are paired, whereas all other bones are single. Now talking about our skull, cranium is acting as a brain box. Inside that cranium, your brain is protected. So that is your brain box. And talking about the cranial bones, some of the properties related with the bones like your occipital bone. So at the base of the occipital bone, there is a large opening which is called as foramen magnum. This foramen magnum is the large opening, which is the largest actually opening through which the spinal cord passes. Okay, present at the base of the skull or at the occipital bone, and at the sides you have got 2 occipital condyle, which is why your skull is dicondylic. At the sides of foramen magnum you have got 2 occipital condyle, which is why your skull is dicondylic. Talking about the sphenoid bone, we very well know because we have covered, we will be discussing about the chemical coordination chapter also. The pituitary gland is enclosed in a bony cavity. That bony cavity of the sphenoid bone is called as sella turcica. So in the bony cavity, sella turcica, what you have is the pituitary gland. So that's the character related with some of the cranial bones. Alright, now talking about the facial bones, 14 facial bones, you have to remember which is paired and unpaired. There are only two bones which are unpaired, which is mandible and vomer. Mandible is the bone of lower jaw. This is the strongest facial bone. Strongest facial bone. Now talking about the other bones, you have got paired, nasal, maxillae, zygomatic. This zygomatic is the prominence of your cheek. This is cheekbone. So nasal bone, maxillae, zygomatic, lacrimal, palatine, inferior nasal concave. Beta, in lot of books you will be mentioned about the location of these bones, but that is not required for now. Okay, while you are revising, try to focus on revision based upon NCERT. Okay, so remember which are paired and unpaired. The only unpaired bones are mandible and vomer, and mandible is the strongest facial bone. Talking about the next part of the skull, I have not mentioned here, I have just mentioned cranial bones and facial bones. The next part is your ear ossicles. While you talk about ear ossicles, you have got in the middle ear the bones which is 3 in one ear, 3 in other ear. So you have got 6 ear ossicles, and each ear ossicle, namely the hammer shape malleus. This is hammer shape malleus that articulates with the anvil shape incus, and that articulates with the smallest bone, which is stirrup shape stapes. Okay, so malleus, hammer shape, incus, anvil shape, stapes is the stirrup shape. So these 3 ear ossicles present each in middle ear of each ear is contributing to the amplification of the sound waves. 10 times sound is getting amplified with the help of this ear ossicle. Talking about the last bone of your skull, that last bone of your skull is a U-shaped bone, which is hyoid bone. Hyoid is a single U-shaped bone which is not articulating with any other bone. This doesn't articulate with any other bone, and this hyoid along with your tongue is responsible for formation of hyoid apparatus. Alright, and this hyoid is actually helping in the movement of the tongue, because to this bone your tongue muscles are attached. So single U shape which doesn't articulate with any other bone is the hyoid bone. So all these bones of the axial skeleton is comprising your skull. Next we are going to discuss about the structure of the ribs and the structure of the sternum. Now talking about the next part of your axial skeleton is the ribs and sternum. Now ribs and sternum both are flat bones. Okay, they are the example of flat bones, and ribs are 12 pair and sternum is a single bone. Talking about the sternum, it is a flat bone which is also called as the breastbone, and it is located on the ventral side of your body. Okay, on the ventral side you have got sternum to which your ribs will be attached. Now talking about ribs, I have written that all your ribs are bicephalic, and a typical structure of the rib consists of 3 parts, namely head, namely neck and the body. Okay, these are the typical parts of your ribs, having head, having neck and the body part. Also beta, if you remember that in the body part, on the body part anteriorly you have a cartilage that is called as intercostal cartilage or the hyaline cartilage. Also I have written that ribs are attached dorsally with the vertebrae, and definitely it is going to be attached with the vertebral column on the dorsal side, right? On the dorsal side it is attached with the vertebral column, but the vertebrae to which it is attached is your thoracic vertebrae. You have got different vertebrae, we will be discussing about that. The ribs are attached with the thoracic vertebrae on the dorsal side, and on the ventral side they are attached with this bone which is called as the breastbone, sternum. Now there are 3 categories of ribs. One is true ribs, false ribs and floating ribs. So talking about the true ribs, they are first to 7 pairs. So first 7 pair of ribs are your true ribs. Now they are also called as vertebrosternal ribs. Just look at the name, you will understand the meaning. They are also called as vertebrosternal ribs. Also I have written that they are attached dorsally with the vertebral column and ventrally with the sternum. So they are normally attached as a typical rib dorsally with the vertebral column and ventrally with the sternum. Since they are attached with the sternum and the vertebral column, that's why they are called as vertebro-sternal ribs. Got the meaning? Also with the vertebral column, also with the sternum. That's why also called as vertebro-sternal ribs. Talking about the false ribs are 8th, 9th and 10th pair. The next 8th, 9th and 10th pair of ribs are the false ribs, which are also called as vertebrochondral ribs. Now why they are called as vertebrochondral ribs is because definitely vertebro, because they are also attached dorsally with the vertebral column. They are attached dorsally with the vertebral column. But ventrally, on the ventral side, they are indirectly attached with the sternum. How they are indirectly attached with the sternum is that the costal cartilage that I told you, the hyaline cartilage that I told you, which is present in the body of 8th, 9th and 10th, the 8th, 9th and 10th rib first articulates with the 7th rib's costal cartilage, and that is then attached with the body of the sternum. Since the 8th, 9th and 10th do not directly attach with the sternum, first they are attaching with the cartilage of the 7th rib, they are also called as vertebrochondral ribs. Alright, now talking about the floating ribs, you have 11th and 12th pair, which is not complete. This is not complete on the ventral side. So, they are only attached on the dorsal side with the vertebral column. And since they are only attached with the vertebral column, they are also called as vertebral ribs. They are only called as vertebral ribs. Alright. And what is the purpose of having floating ribs is to protect the visceral organs. They are going to protect your kidneys. That is why they are incomplete. That is your floating ribs. Now, talking about the vertebral column, you have got the vertebral column and you have got the vertebrae, which is different at the time of birth or fetal stage, and in the adult it is different. So, what happens in the, first I have written what is the name of the vertebrae, I have written the location, I have written their number during the fetal stage or in the newly born, and their number in the adult stage. There is a difference in the number of vertebrae of the adult and the newly born or the fetal stage. Now, let us see the name of the vertebrae first. When I am saying cervical vertebrae, cervical is located in the neck region. When I am saying thoracic vertebrae is located in the thorax area. When I am saying lumbar vertebrae, that is present in the abdominal area. And sacral and coccygeal vertebrae, both are present in the pelvic region. Now, look at their number. Whenever I will be saying cervical vertebrae, it is same for adult and newly born, 7 and 7. The thoracic is 12 and 12, same for newly born and adult or in the fetal stage. Lumbar is same, 5 and 5. Whereas the sacral and coccygeal varies. The sacral, which is 5, get fused to form a single vertebrae in the adult, and the coccygeal also 4 gets fused to form single in the adult. That's the reason why you see 26 vertebrae in the adult and only 33 vertebrae in the newly born or in the fetal stage. Now let us look at some of the properties related with the vertebrae which are specially mentioned in your NCERT. Now students, let's discuss some of the important points regarding your vertebral column and talking about the characteristics that I was telling you. If you look at your vertebral column, you have got certain curves in your vertebral column. So in your NCERT also your vertebral column is given like this. Okay. So there are curves formed of your cervical curve, your thoracic curve, your lumbar curve and your sacral curve. Some curves are called as primary curves and some curves are called as secondary curves. When you are saying primary curves, the curves which are present since birth. Since birth, the curves which are present are called as the primary curves like your thoracic and sacral. But the curves which are developed later in the life, they are called as secondary curves. I have written the cervical and lumbar curves are called as secondary curves. You can easily understand this is because when we were the child, infant, initially the neck was not that, neck couldn't stand like this because your cervical curve did not develop. But as the baby starts to lift his head, that is the time when the cervical curve starts to develop. Also the lumbar curve, you will see that the lumbar vertebrae bears the whole body weight. So that starts to develop when the baby starts to stand. Since both of these are developed later during the life, they are secondary curves. Now I have written some of the heading as important points. I will be discussing the important points one by one. The very first point regarding the cervical vertebrae that we need to discuss is the very first cervical vertebrae is called as atlas. Do you know why the very first vertebrae is called as the atlas? This is the first cervical vertebrae. I am writing C1. Because if you see the cervical vertebrae atlas, that is going to form the joint with your skull with the occipital condyle, and the atlas forming the joint with the occipital condyle is called as atlanto-occipital joint. That's called atlanto-occipital joint. And this atlanto-occipital joint, with the help of this, you are going to do this yes movement. Okay, so that's the atlas. And why is it called as atlas? Because atlas, somewhere you relate it with the map or the globe. So your head is considered as the globe, and this globe is present over the atlas. So you are doing this movement. That is why it is called as atlas. This is a typical, atypical cervical vertebrae. Actually, there is certain things called as typical and atypical in your vertebrae. Okay, when you are saying a typical structure of vertebrae, means it should have all these structures similar, same in all. If you have certain exceptions, that exception leads to the atypical kind of a structure. Okay, if you have some additional structure, or you have some structures which are not present when comparing to a typical structure of the vertebrae, that's when it becomes atypical. Anyway, we are not talking about atypical and typical. We are saying that atlas is the first cervical vertebrae, and it forms a joint with the occipital condyle called as atlanto-occipital joint, showing the yes movement. Now talking about the second vertebrae, second cervical vertebrae only, that is axis. This is called as axis. And what happens is, suppose this is the body of the second cervical vertebrae, which is axis, and over the axis on top you have atlas, right? And this axis is going to form joint with the topmost atlas. But how it is forming joint, beta? There is a process like this. There is a process like this blue chalk. This process through the axis is called as odontoid peg. The process through the axis is called odontoid peg, and this odontoid peg is responsible for formation of joint with the atlas, with the help of which you are going to do this movement. This is the no movement, and this movement with the help of this odontoid peg is called as a type of pivot joint, which we will be discussing later. Got it? Now talking about the cervical vertebrae, which is the seventh cervical vertebrae. The seventh cervical vertebrae is called as vertebral prominence. It is called as vertebral prominence. Why it is called as vertebral prominence? As there is a tubercle knot-like structure. When you move your head down and try to touch at the base of your neck, touching at the base of your neck, you will find an elevation. You will find an elevation. That elevation is called as tubercle. And that elevation is called as tubercle. This tubercle can be felt at the base of the neck, which is why the seventh cervical vertebrae is called as vertebral prominence. Got it? First is atlas, then axis, then seventh is vertebral prominence. Now these were your cervical vertebrae. Talking about the thoracic vertebrae, the very important property of thoracic vertebrae is beta, this is the only vertebrae, 12 in number definitely, but this is the only vertebrae which is attached with your ribs, because ribs are 12 pair, and all the ribs are attached on the dorsal side with the vertebral column, and the vertebrae to which it is attached is the thoracic vertebrae. Now you can remember one additional point, that there is a process through the vertebrae which is called as transverse process. This transverse process helps in the attachment with the ribs, okay? This transverse process helps in the attachment with the ribs, which is very well developed in the thoracic vertebrae. Present in all, but very well developed in the thoracic vertebrae, because this is the vertebrae which needs to attach with your ribs. Now talking about the other vertebrae after thoracic vertebrae is your lumbar vertebrae. Talking about the lumbar vertebrae, lumbar is the strongest vertebrae, and this lumbar vertebrae is going to bear the whole body weight. So the entire body weight is upon the lumbar, which is the strongest vertebrae. Talking about the next vertebrae, which is sacral. Now sacral, students, you know it was formed as a result of fusion. So 5 got fused into a single triangular sacral, which in case of female, remember, in case of female it is small but is wider, okay? It is exactly opposite in the males. You know that. It is present in the pelvic region. It is smaller but wider in case of female. That is also helping in accommodating the fetus during the embryonic growth. Talking about the last, which is the coccygeal, this coccyx, which is going to fuse and form the vestigial tailbone, that is the coccygeal bone. Alright, so that's about your vertebral column, and that's about the very first part we have covered. Next we are going to move to your appendicular skeleton. Now talking about the appendicular skeleton consists of 126 bones, as we have already discussed, and it consists of the girdle bones and it consists of the limb bones, okay? So first let us discuss about the girdle bones, which were 6 in total, okay? And your girdle bones can be divided as pectoral girdle and your pelvic girdle. Each half of your pectoral girdle has 2 bones, which is why in total 2 bones on this side, 2 bones on this side, 4. But remember that each half of your pectoral girdle is separated, it is not fused. Whereas when you talk about the pelvic girdle, each half of the pelvic girdle consists of one bone. Each half consists of 1 bone. That 1 bone is called as coxal bone. That 1 bone is called as coxal bone or innominate bone. Innominate bone, and each half is fused, unlike the pectoral girdle. Each half is fused on the ventral side. Remember that with the help of the pubic symphysis, you know that pubic symphysis is a cartilage. With the help of pubic symphysis, the coxal bones are fused ventrally. Now let us see that how each half of pectoral girdle looks like. Each half consists of 2 bones beta. One is clavicle and other is scapula. Scapula, as you can see, this is the scapula, which is a triangular structure, whereas clavicle is the collarbone. This collarbone is attached here with the sternum, okay? The clavicle on this side is attached with the sternum, but here on the shoulder, you always feel this elevated part, right? This is the joint of the clavicle with the scapula. So clavicle is joined with the scapula on the flat blade-like spinous process. That flat part, that this is a spine, okay? This spine is arising from the scapula. So this spinous process that arises from the scapula is flattened. This flattened part is called as acromion process, to which your clavicle is attached, and this you can feel on your shoulders. Talking about this cavity beta, this cavity is called as the glenoid cavity, and this glenoid cavity, remember, your humerus is attached. And do you see, we will see the joints. This is going to form the complete movement ball and socket joint. So the glenoid cavity for the attachment with humerus, and the acromion process, flat blade-like spinous process, flat part to the attachment of clavicle. Now talking about, so these are the 2 bones, okay? Now talking about the pelvic girdle, each half was called as coxal bone, and each half consists of 3 fused bones to form coxal bone. These bones are ilium, and remember the spelling is I-L-I-U-M. because ium is a part of small intestine. Now ileum, ischium and pubis, these three bones fuses to form a single coxal bone. Do you see an area, a part where your ileum, ischium, pubis are fused at a common point? This common point is called as acetabulum. This acetabulum is the site for the attachment of your thigh bone. That is your femur. Whereas here you had glenoid cavity for the attachment of humerus. Now talking about, so acetabulum, you have to remember that it is present at the junction of all the three, ileum, ischium, pubis. But also at the junction of ischium and pubis, do you see a cavity? That is obturator foramen. Remember, obturator foramen is present between ischium and pubis. That is partially covered with membrane. And obviously this is one half, that is coxal bone. There would be another half of the coxal bone, and both the pubis bone on either side will be fused ventrally with the help of pubic symphysis. Okay, that's a cartilage. Now talking about, this was beta the girdle bones. Okay, I hope you will follow the NCERT to understand the structure of all of these. Okay, remember where the humerus is attached, remember where the femur is attached. Now talking about limb bones, you have forelimbs and you have hind limbs. Each forelimb consists of 30 bone, each hind limb consists of 30 bone. Talking about the forelimb, the very first bone I am talking about is humerus, this one. You have got humerus, you have got radius and ulna here, then you have got carpals, metacarpals and phalanges. Very first structure of the humerus I have made, there is this head part and there is this distal part. This head part is going to attach with what? You can easily see here, with the glenoid cavity of the scapula. So this attaches with the glenoid cavity of the scapula and going to form the ball and socket joint. Also for the attachment of the shoulder arm muscles, there is a ridge over the body of the humerus which is called as deltoid ridge. So this deltoid ridge is for the attachment of the arm muscles. Talking about the olecranon fossa, this humerus is attached here with the radius and ulna. So it is attached with the ulna, the longer bone, with the help of this olecranon fossa. And on the ulna you will see there is a process called as olecranon process. Okay, so that's the structure of your humerus which is single. Now let us see what are the other parts of your forelimb. Now talking about the other parts of forelimb, you have humerus was covered, that was the single bone. Then you have in this region radius and ulna. Okay, both single and single. Always remember that towards the thumb the bone you have this one, towards the thumb the bone you have is radius. Okay, and ulna is placed on the outer side and ulna is a longer bone when compared with radius. Now talking about this entire hand, you have got some bones. In total 27 bones, you have got in the wrist area 8 carpals, not 7, 8 carpals. Then in the palm area, you have got 5 metacarpal. Then in the fingers, you have got phalanges. What I have written here is the phalangeal formula. 2, 3, 3, 3, 3. What does it mean is that you have got 2 phalanges in your thumb. And in remaining finger, you have got 3, 3, 3, 3 phalanges. Talking about your hind limbs, in your hind limb you have got the thigh bone which is the femur, single longest bone. Then you have got in this shank area tibia and fibula. Tibia is placed medially. If you look the position of the medial bone, that's the tibia, and this is stronger than fibula. This is medially placed and this is stronger. Talking about the fibula, fibula is located laterally. So again single, 1 and 1, tibia 1, fibula 1. Talking about the other part remaining, your sole part, you have got 7 tarsals, you have got 5 metatarsals, you have got 14 phalanges. Now here look at, here is the thing to remember. You have got 7 tarsals but you have got 8 carpals. Don't get confused. And here when you total it, 27, 28, 29, humerus is 30. But here when you total, this is 26. So 26, 27, 28, 29. The 30th bone is your kneecap, which is the patella. Okay, that's the kneecap. So that's how we finish your entire bone of appendicular skeleton and your axial skeleton. I am again telling you, please focus on NCERT to understand all the bones. Okay, at least remember what is given in NCERT. Next we are going to discuss about the different types of joints, and then the last part will be the disorders of this chapter. Now talking about the joints, there are different types of joints that are present in your body, and these joints have actually come from the word arthrose. Okay, because generally you will see that in joints we use the term arthrose, synarthrose, amphiarthrose, diarthrose, like that. Okay, so whenever we are saying joints, we say arthrose because arthrose have come from the arthropoda. And arthropoda we say jointed appendages. So from there only we have got the term arthrose. Anyway, talking about the very first type of joint, which is synarthrose or fixed joints or immovable joints. So all the names you will remember: synarthrose or fixed joints or immovable joints. So in this case the bones are totally fixed and they will not move at all. They will show no movement. Bones are fixed with the help of white fibers. When you are saying white fibers, beta, remember you are saying collagen fibers. Okay, there is a slight difference between the synarthrose and the amphiarthrose. Okay, so that's why I am telling you to focus on the name, focus on this, that the bones are fixed with the help of white fibers. Like that, sutures found in the cranium. Do you see some structures like this? This is one cranial bone, this is another cranial bone, like this structure, this is suture. So this suture is nothing but the fixing of the two cranial bones with the help of white fibers. Now talking about the second type of joint, that is amphiarthrose or cartilaginous joints or slightly movable joints. They were completely immovable, but the type of joints where the two bones are fixed with the help of white fibrous cartilage, not the white fibers, they are fixed with the help of white fibrous cartilage, that is called as amphiarthrose or cartilaginous joints, or they will show slight movement, hence they are called as slightly movable joints. Okay, the examples are pubic symphysis. Just now we discussed that each coxal bone is fixed or fused on the ventral side with the help of the pubic symphysis, which is a type of cartilaginous joint. Okay, that's a white fibrous cartilage. Talking about the intervertebral disc, which is present in between the two bones, in between the two vertebrae, that's also the example of the slightly movable joint. Now the type of joint which is going to show the maximum movement, that is called as synovial joint, or in terms of arthrose it is called as diarthrose joint. So maximum movement, diarthrose joints. Now why is it called as synovial joints? Actually you will see that there are two bones, two long bones like this, and in the two long bones, in between these two long bones, what you will see is the presence of a fluid. That fluid is going to act as a lubricant. That fluid is going to act as a lubricant, prevent friction between these two bones, and that is also going to provide nourishment. That synovial fluid which is present in between these two bones is secreted by the membrane which is called as synovial membrane. Also remember that at the end of the long bones you have certain cartilage, beta. That cartilage is called as hyaline cartilage, that is present at the end of the long bones. But the characteristic feature of the synovial joint is the presence of synovial fluid in between the long bones, that is going to reduce the friction. Now we are going to discuss the different types of synovial joint, which could be ball and socket, hinge joint, pivot joint, saddle joint, angular or condyloid, sliding and gliding type. So I have made this thing. Okay, this is your forearm and this is your girdle bone. Okay, so that's the structure. I hope you are clear with this structure. You know, I am again revising it, I am again telling you. Just tell me, this is the scapula, and I have just now told you what is this cavity. This cavity is the glenoid cavity. Talking about the glenoid cavity articulation, that articulates with the humerus. Also this humerus is going to articulate with the two bones, which is radius and ulna. The radius being towards the thumb. How did I identify which is the thumb? That I will tell you, but radius is towards the thumb and longer bone is the ulna. Then these are beta the carpals, these are the metacarpals, these are the phalanges. Now how to identify that this is the radius which is towards the thumb? Because you will see this is the thumb where you have two phalanges, right? You have two phalanges. Now talking about all the types of synovial joints. The ball and socket joint is the shoulder joint. The shoulder joint and your hip joint both are an example of ball and socket joint which is showing maximum movement. Your humerus and your femur bone that is attached with the pelvic girdle is going to show maximum movement in all direction, called as ball and socket joint. Now talking about the other two joints, the hinge joint and the pivot joint. Listen carefully. When you are saying hinge joint and pivot joint, beta, both are movement in one plane. Both are movement in one plane, but one is slight rotatory kind. When you talk about hinge joint, this knee joint, this is the elbow joint and the knee joint here. The elbow joint, do you see? Can you move it backward? No. You can just move it like this. So this is movement in one plane, but there is no rotation. So movement in one plane, just like you open a door. Door is opening in one direction, right? The door that opens in one direction, just like a door, movement in one plane is the hinge joint. We can say that the knee joint as well as your elbow joint are an example of hinge joint, movement in one plane. But again a movement in one plane but slightly rotatory kind, okay? Movement in one plane but slight rotatory type. What I have made here is the joint between radius and ulna. Now what happens, you can do, you can move forward your hand and you can do this pronation, supination, pronation, supination. If you hold your knee at this elbow joint, you hold this elbow joint and you try to do this movement, you will see that your radius is rotating over the ulna. Your radius is rotating over the ulna, but it cannot rotate completely like this. So movement in one plane, slight rotatory kind is called as pivot joint. Have you seen pivot joint anywhere else? Pivot joint is also present in between your atlas and axis, which is why you are able to do this. You cannot rotate your head like this because not in all the direction. Just movement in one plane but slightly rotatory kind with the help of the odontoid peg of the axis. It is forming joint with the atlas called as pivot joint. Clear? Both are movement in one plane. Saddle joint is a kind of poor ball and socket. It's a kind of poor ball and socket that is present only in the thumb. This is present only in the thumb, and in the thumb, remember this one. And in the thumb, it is, can you see the rotation is taking place from here. So the saddle joint is present in between carpal and metacarpal of your thumb. That's the saddle joint. Talking about the sliding and gliding joint, that is the simplest type of synovial joint. This is the simplest type of synovial joint, and if this is the simplest type of synovial joint, only sliding movement is taking place. When we move our hand, so in between the carpals, the kind of movement that you see is sliding joint, or in between the tarsals you see is slight movement, that is sliding or gliding joint. Okay, that's the simplest type of synovial joint. Talking about the last type of joint, which is angular joint or condyloid joint, students, this is movement in two planes. This is movement in two planes. Now you can do like this. Look at this thing, index finger. You have your phalanges, right? Now this phalanges you can move like this and you can also do like this. Okay, you can do like this, you can also do like this. This is movement in two plane. So between your phalanges and your metacarpals, you see the angular joint or condyloid joint. Also in between your atlas, the first cervical vertebrae, and your occipital condyle, you can do this yes joint, and you can also do this, not the no movement, okay? This yes and this movement. So movement in two plane. Atlanto-occipital joint. Atlanto-occipital joint is an example of angular joint, and between the phalanges, and the metacarpals also you see angular joint or condyloid joint. Now students, I have written in a note about lever system. Actually this lever system is not described in an NCERT, so won't go much in detail about this. Just remember certain terms that because there is a term called fulcrum given in your NCERT. So you should know that fulcrum means what. So all the movement that is taking place in our body is because of the arrangement of these joints with the muscles, right? So wherever you come across the term fulcrum, understand that it is joints. The effort is provided by the muscle and the resistance is your load, okay? So just because the word was mentioned, I have told you about this. The questions are never asked in the NEET, okay? So not a problem, not an issue. The class 1, class 2, class 3 lever is not that required. Now talking about the last part of this chapter, which is the disorders. Now talking about all the disorders one by one. The very first disorder that I have written is the myasthenia gravis. Remember, important point is what is an autoimmune disease and what is a genetic disease. Compare these two. Whenever you are saying muscular dystrophy, that is a genetic disorder, and when you are saying myasthenia gravis, that is autoimmune disease. You know very well that in case of autoimmune disorders, you start producing antibodies. And what happens here in case of myasthenia gravis, pay attention that you start producing antibodies against the acetylcholine receptors. Now, if you are producing antibodies against acetylcholine receptors, binding of acetylcholine will not take place. If there is no binding with the acetylcholine receptors, obviously muscle contraction will not take place. Your muscles will slowly start to degrade. That's the case seen in case of myasthenia gravis. Talking about muscular dystrophy, it is a genetic disorder where a protein called as dystrophin is not formed. This dystrophin is responsible for connection. This dystrophin is not formed and this connects your sarcolemma to the thin myofilaments. If the dystrophin protein is not formed, the muscle contraction is not going to be taking place uniformly. The dystrophin protein, when not formed genetically, is also going to cause the degradation of muscles with time. Okay, here the acetylcholine receptors were damaged. Here the dystrophin protein is not formed, which is a genetic disorder, which is muscular dystrophy. Do you know how myasthenia gravis patients can be treated? If you give the acetylcholine esterase inhibitors, then you can treat the patient who are suffering from myasthenia gravis. Why? Because the acetylcholine esterase enzyme breaks the acetylcholine. You want at least whatever receptor is left that can bind with the acetylcholine. So that's how you can prevent the myasthenia. You can help the patient by giving acetylcholine esterase so that more amount of acetylcholine is left in the junction so that whatever receptor is left can bind with it. Talking about tetany, tetany is the faster or wider contraction which is because of low level of calcium in the ECF. Because of low calcium in the ECF, wider contractions takes place, which is tetany. Arthritis is simply the inflammation of joints, which can be of different types. When the inflammation of the joints is because of the accumulation of uric acid crystals, that is called as gout. When the inflammation is an autoimmune disorder, that's rheumatoid arthritis. In the rheumatoid arthritis, you are going to inflame. The inflammation is seen in the synovial membrane. Increase in the synovial fluid is seen. Abnormal granules called as pannus is formed, and this abnormal granule and increase in the synovial fluid exerts more pressure on the joints. That is called as rheumatoid arthritis, inflammation of synovial membrane and autoimmune disease. Talking about osteoarthritis, in osteoarthritis, inflammation of the hyaline cartilage, the articular cartilage takes place. So, inflammation, uric acid crystals, inflammation of the synovial membrane, inflammation of the hyaline cartilage. Talking about osteoporosis, that is the age-related disorder. With age, what happens? Due to maybe in disbalance in the hormones, like calcitonin or parathormone, pores are created in the bone, and those pores created in the bones are called as osteoporosis. Also, that is more commonly seen in the females, because even estrogen has a very important role in maintaining the calcium homeostasis. So, because of deficiency of vitamin D maybe, which absorbs the calcium, or maybe because of the disbalance of calcitonin, parathormone, and maybe because of the overactivity of parathormone, which takes out all the calcium from the bone, creates the pores. That problem is called as osteoporosis. Okay, just remember the terms at least which are given in your NCERT, like genetic disorder, autoimmune disorder, where you are dystrophin protein is not formed, that is muscular dystrophy, where you are damaging the acetylcholine receptors, that is myasthenia gravis, where there is low level of calcium, that is tetany. So that's how we complete all the disorders and we complete this chapter. Make sure you read from NCERT. We are going to be back soon with the new chapter. Till then, take care, stay happy.